Welcome back. Everyone, Tammie Colon's with us from Mental Health Recovery Services, talking about a couple of things. They have an event coming up Friday. Also, we want to talk a little bit about that 988 hotline. You know, you sent me some information, and this was very apropos because I thought to myself, there are people that, I don't want to say are going to abuse it, but they're going to get confused about when to call this, when to call 911, when to call that. So give us a sense of kind of what the line's made for and what it's supposed to be used for.
Yeah, well, it's a national initiative, right? We want people wherever you are in this country, if you are in a crisis, mental health crisis versus a medical crisis, to have one number that you can call, which is 988. But it's new. It's a new initiative. Ohio has just started to roll it out. We have to work through some kinks.
Sure.
But the value of it is that wherever you are, you won't have to learn your local number. Right. You won't have to identify a local hotline number like we've always had with our 1-800-567-HOPE line. But that you can just dial 988.
Yeah.
If you need to be transferred to 911, the intention is to transfer to 911. If you forget and you call 911, the intention then is to transfer you to 988.
Yeah.
So it also helps the national operators, our emergency operators, to also remember one number to transfer those callers to.
That makes sense. Now, will the Hope line still exist then locally?
Absolutely.
Yeah.
The Hope line is still going to exist. We're blessed. They happen to be one of the call center operators for the state of Ohio, although they've expanded to multiple counties. They are here in Lima. They are still serving our communities, and we will continue to take those calls for folks who want to use that number in the same capacity we always have, and continue to operate the additional services off that Hope line that we do.
I'm glad you mentioned that, because it's not a receptionist that answers, it's a trained professional to get you what you need, right?
It is on the Hope line.
Right.
At this moment, the frustration that I think community members are feeling when they call the 988 is that there's a recording.
Oh, okay.
Because they have to get you to the correct call center for your location. That takes a little longer. People aren't used to that. They're used to calling their local hotline number and it picking up with a live human professional.
Yeah, well, I guess the idea is they're trying to get you to who you need to talk to.
Yes, and right now without the geolocator on 988, that's even more challenging. They're trying to use area codes to identify that, but the state is committed to getting that geolocator available for callers so that we don't skip a beat here.
Sure. Is there ever a time that you, I don't want to gauge the level of emergency you would be in, but is there ever a time that you would call that number 988 or me or somebody else for someone else? Does that make sense?
Absolutely.
Yeah. Okay.
Yes. If you have someone that's experiencing symptoms or in a crisis, you're not able to console them, you're concerned about what's going to happen in the next 5 minutes or hour, you most definitely should call the 988 number. If you have somebody that's overdosed, if they've hurt themselves, if you believe in the next 5 minutes they're going to hurt themselves, then you would want to call the 911 still. Okay.
Celebrate You comes up Friday then, right? Okay, tell us about that.
Well, we're excited. This is the second year we've done it. We started it last year. While we focus a lot on the consequences of our recent events in our world and the challenges it's having on people's mental illness, we also want to focus on wellness. We want to really provide people an opportunity to come out. Let's celebrate one another. Let's celebrate we're all still here.
Sure.
Let's focus on something more positive. And so we have music and food and artists. And again, it's just a moment to take a reprieve, take a deep breath, and really appreciate that we're here.
Yeah, and you said it starts at 4 o'clock at Vibe Coffee House.
That is correct. Yep, and Mixed Vibes is providing our musical entertainment along with some expressionists, and we're very excited about it.
Good stuff. Had me at food trucks. There you go.
That's right. Come on out. It's open to everybody.
Yeah, it'll be a good time. Thank you, Tammie. Appreciate it. Good seeing you. No Going Medical News coming up next on Noon Edition.